Minimal residual disease has gained a lot of attention recently. There are a number of techniques in doing it. We have adopted doing the test routinely since around 2013 on all our patients. So we looked at the outcome of 1,759 patients who altogether had about 20,000 MRD tests, which is one of the largest series evaluated thus far, and examined the importance of negative or positive MRD test in the context of a transplant-based treatment strategy. So patients received induction, transplantation, consolidation, and maintenance. And we examined their MRD test just before transplant and then subsequently afterwards. And these patients have long-term follow-up. Now, what we found is that patients who are persistently MRD negative, that is, have 3 serial MRD tests in the first 5 years after transplant, have an excellent progression-free survival with very few relapses. So that's a group of patients which is potentially so-called cured. Conversely, patients who are persistently MRD positive are at increased relapse. Now, there are also patients who have significant MRD negativity. They don't achieve this magic number of 3 in a row, or 3 in a row in the first 5 years, but they have a significant number of negative MRD tests. And many of these patients stay in remission by classical criteria as well. So the take-home message, obviously MRD negative, particularly serial MRD negativity, is excellent. And these patients have the best outcome, but not everybody with a positive MRD test is destined to relapse. And I think that's particularly an important message for patients. Because when you see patients in the clinic and with so much publicity about the benefit of negative MRD test, they're very often scared when they get a positive MRD result. And I think it's important to understand the whole collective data set of MRD data that is out there. And I think this very large series shows that some MRD positivity does not necessarily confer a poor prognosis.